Thanks for having me. So I'm Sophie. I work in the Department of Public Health Policy and Systems in Liverpool. I guess in the short time that I have with you, I wanted to focus on the challenges that I've experienced in attempting to understand the causal relationship between complex, messy welfare changes and mental health outcomes using understanding society's data. I had hoped to share findings with you, particularly using some administrative data, but that work has stalled at the present. So it's going to be focusing specifically on data using understanding societies, which we've linked to DWP data based on individuals' local authority area of residence. So I guess the headline takeaway that I have for this is that unraveling these causal pathways is head hurting, and it'd be great to talk to you guys about it afterwards. So this work spans two projects that I'm involved in, where we use natural policy experimental designs using difference and difference approaches primarily to explore the causal relationship between universal credit and child and maternal mental health. That's for the NIHR project. And then also exploring specific aspects of welfare policy changes. So, for example, the introduction of the two-child policy limit on poverty, and that's the UKRI one that I'm involved in as well. I'm not going to dwell on the literature, but there is a dearth of evidence on the mental health impact of welfare changes now, both from qualitative work and quantitative work, not just universal credit, but working capability assessment, the rising in conditionality and sanctions, and also the scarring impact of poverty. It's quite clear that, and has been spoken about by Philip Alston back in 2018, that poverty in the UK has been described as a political choice, and there is a need for causal approaches to understand the mechanisms at play to discuss and affect positive policy social changes. And I just wanted to highlight some great work on the public engagement side of things as well. So this is colleagues from the Northeast doing a project with people with lived experience of universal credit. Do you see us? It's a website. I'll put the link up on the chat afterwards, but please go and have a look. They've got a virtual tour of some work that they've been doing. So starting out with exploring these policies, you have to ask a research question. We all know that. But that is where I think the trickiest bit is. So I want to understand if universal credit has had an impact on mental health of children and women, particularly mothers. And can I make a causal link between the implementation of universal credit and mental health outcomes? For that, I need to be really clear and transparent about what my exposure is. So one of the reasons that this is possible, particularly with this policy, is because of how it was implemented. So there was variation in how universal credit was implemented, both in time and geographically, which makes it particularly good to explore these causal relationships. The problem that you come to analytically speaking is potentially the subgroups that we're interested in. So children, women, other potential groups that may have been impacted in a different way don't necessarily show up on a population level until further down the line. But in principle, it seems very possible. And this just shows sort of the complex and messy nature in which universal credit has been implemented. It's not. There we go. The data that both projects use to explore this is Understanding Societies, which is a rich data source. It's got 40,000 households on both health and non-health related factors at both individual and household level. And with special license agreements, you can link these to area level factors, which is how we've linked it to the Department of Work and Pensions data for numbers of people in somebody's area that have been exposed to universal credit. And if it'll let me click, there we go. So just make sure I haven't clicked twice. There we go. So the plan for my universal credit project is to not just look at the whole population mental health effect, but to also look at lone and coupled parents mental health impact and children of lone and coupled parents, particularly mothers. We also want to look at people with disabilities and caring responsibilities, and also a comparison between under 25s and over 25s, as the policy also discriminates based on age. So under 25s get a lower amount. And then with the 2-child limit analysis, we're interested in exploring the poverty risk for larger families as a result of moving on to that, as a result of the 2-child limit. So the challenge with both of these, and I guess I think it's the most important part of this kind of design, research design, in my mind at least, is ensuring that I am capturing what I think I'm capturing, and I'm capturing the policy accurately. We know that within survey data, across the board, there's an underreporting of benefits, and that is also true of understanding societies, which this sort of graph highlights. And one method to overcome this within understanding societies is to link it to DWP, based on their areas, which I've described earlier. But the first challenge is to identify a strong and valid proxy measure of the likelihood that a person is eligible for universal credit. And the second challenge is identifying an appropriate comparison sample. So, but both studies defining this has been the biggest headache. So knowing that there is an underrepresentative in the data set and trying to find an appropriate definition to capture this in order to capture the true causal effect is fundamentally important. And I'll show you why with a concrete example in a few slides' time. So we've decided for both projects to take broadly 2 approaches. The first explores the actual reported data, so using both people that have reported receiving universal credit alongside people that report one of the 6 legacy benefits that did transition to universal credit as our exposure of interest. And then you link this with the DWP data. And we make an assumption that once UC is available in someone's area, they will have moved to UC. So that's based specifically on those legacy benefits group. The issue with this is, with that approach, is that it is potentially small numbers, so you're likely to see a big effect. And then the issue with the further issue is in defining the comparison sample. What's the appropriate comparison sample that is the most similar but different enough to not be impacted by the policy? So we've chosen 2 approaches, one based on people that report other welfare benefits, so those that are not impacted by universal credit, not reporting the 6 legacy benefits, and then people that report no benefits. And I'll show you a bit later the differences that approach has. The alternative approach, approach B, uses equivalized income. And this approach is designed to try and deal with the underreporting within understanding societies. So we basically take the reported people on UC, people that have reported being on UC, and look at their income distributions and then apply a threshold to try and capture the most people that report UC, but put that back out onto the population to within understanding societies to try and identify an appropriate income threshold and apply it to a whole sample to capture others that may be missing or not reported. And when it's linked to the DWP data, you can make an assumption that these people are eligible for universal credit. Well, this will likely overestimate the number of people impacted. This is further complicated by identifying an appropriate comparison group. So if you use the same sort of approach by looking within the data at people that have not reported universal credit and taking a similar threshold, there will be people that will sort of merge between the two. So for example, I think for lone parents that are on universal credit, say that income is around 13,000. If you look at lone parents that don't report universal credit, maybe it's 19,000. But you will still have people on universal credit that are up the 19 and people that are not on universal credit that are lower. But it's an approach, and that will, as a result, be conservative, because you'll have this effect where there will be people sort of in both groups. But you're making, as long as you are transparent and you are clear, about the assumptions that you are making in defining the eligibility, that's all you can do really, without individual level data. So the assumptions that assuming we've made a decision about the correct exposure using these methods and we have defined outcomes, we move forward with an analysis. So in my work, in general, we use difference and difference approaches. This allows us to compare those people that we've defined as eligible or as the intervention group, look at them over time, comparing them to a comparison group that is as similar as possible to the intervention group. The important bit is this period, which is the like the before period, which there's a common trends or parallel trends assumptions that needed to make. So you want those lines to be parallel. And then any assumption of change in outcome will have occurred in the intervention group, you can attribute to the policy. Now, for universal credit, this is additionally challenging and messy when exploring because the policy changed over time. So the experience of universal credit in terms of mental health for somebody exposed in 2013 is different from somebody exposed in 2018 because, say, the wait for their first payment was 12 weeks in 2013 versus 5 weeks in 2018. So here, this was the reality in highlighting why it's really important to be clear and why we define. So this is approach A. So this is where we can change the comparison sample. So this is based on people's actual reporting of benefits before the policy was introduced for them, and then afterwards. This one is other benefits, and this one is the whole population, is the general population. People not reporting benefits. And you can see how this is likely to impact the results. But a more concrete example of why it matters, I can give from work that I led for a master's student a few years ago, and was presented at SSM last year, so apologies if anyone was there, where we looked at the impact of the bedroom tax on mental health using the same approaches. So we were very clear about our exposure. Our study population was residents in social housing that were receiving housing benefit. And the only difference to identify the exposure to the comparison group was bedroom tax, which was defined as reported bedrooms versus allowed bedrooms, because it's an under occupancy tax, so people get a lower amount. So, it changes the income that household, the benefit that household will get, and compare the two groups over time. We had lots of covariates, but I won't get into them. So we had small numbers. The point is, we try to be as specific as possible in defining our exposure. And what we found was, for both groups, there was a decline in mental health over time. There were also issues around the parallel trends assumption, but I won't go into that for the purposes of this. The issue with this finding, and I guess the challenges, and it'd be interesting to have discussions with people about this, is how we interpret the results. So both groups were exposed to, I interpreted the results as both groups were exposed to wider changes to the social security system at the same time as the bedroom tax, and experienced a marked deterioration in mental health over the study time period. This diverges from the qualitative literature. We asked at SSM whether it was appropriate or meaningful to do further investigations, look at additional data or an alternative comparison group, because they were too similar to the exposure. Were we actually able to capture the impact of the bedroom tax on mental health, or were we capturing something else, or was it confounded by something else? Should we be looking at an alternative outcome measure, or do we accept it as a true effect at the population level? And very quickly, because I know I've gone way over time and I apologize, is, I guess, some things that doing all of this work has sort of brought to my mind is that overcoming these challenges and trying to address them is all about making sure that you are transparent in what you're doing, being clear about the assumptions that you're making, publishing protocols where possible, and sharing code. And I think even when it's quantitative data, our positionality matters, because somebody that was, I suppose, the reasons we ask the questions that we ask comes from a position, and I'd really love to talk to people more about that. I think the overwhelming thought is that we need to do a better job collectively at being clear about defining things from the outset, and understanding that defining and understanding our exposure to understand the causal mechanisms to mental health, particularly when we're looking at children and women and other sort of vulnerable groups. We need to spend a long time thinking about the mechanisms to be clear. I'm not making a very good lasting statement here, but we need to be spend more time at the beginning of projects thinking about these things, conceptualizing them in order to make causal assumptions to be confident in our results. Thank you.